Hello, my name is Simeon Neelasha, and the trigger point of the week this week is the quadratus plantae muscle, or QP as we like to call it. So we're going to search in the new software and we're going to look for the quadratus plantae. There it is. So quadratus plantae, the reason we're looking at it today is it's very much associated with heel pain, especially with heel spur or heel spur pain. So like always, let's just start with some of the anatomy. So there are two heads in terms of the origin. There's the medial head, which comes from the calcaneus, and the lateral head, which is also from the calcaneus, but it's from the lateral sort of inferior border. And in terms of the insertion, it inserts into the tendon of flexor digitorum longus, or FDL. So it inserts into the flexor digitorum longus. Now, if we have a look at it, we can see that the origin is actually on the heel itself. And what can happen is if this muscle gets tight, it's one of the sort of plantar surface of the foot deep muscles, it can pull, and if you get trigger points in there, they can actually cause a slight hook to develop in the calcaneum. So when they talk about a calcaneal spur, it's usually the QP that is the progenitor, is the muscle that does that. So look, let's look at in terms of pain, and we can see in terms of the pain map, very much heel pain. Some other muscles that make heel pain are, for example, the gastrocnemius, or soleus sometimes. But in terms of the heel spur, we would urge you to look into the quadratus plantae muscle. Small, squat. It is accessible using trigger point techniques, and we actually get some really good results. So it's always a curious thing with heel pain, isn't it? Because we run on our feet, we jump on our feet. We don't think about them until they go wrong. And I'm sure you'll recognize that as soon as the feet start to go wrong, they become exquisitely sensitive to pressure, and almost anything can trigger heel pain. Classically, worse in the morning when you wake up. So some of the advice, as much as treatment, it's sort of advising people on heel pain. And some of the things I found really helpful are, first of all, to never go barefoot. So never go barefoot, always have slippers ready. And the other thing is to try and stick to one pair of shoes, or two pairs but the same shoe. And this is because you're not traumatizing the area, you're sort of using one strain pattern going through it rather than subjecting it to sort of almost infinitesimally small, but definitely their different mechanical forces. So no barefoot, try and stick to the same shoes, and to treat the quadratus plantae. So in terms of treating, I use IMS needling, phenomenal technique if you get it right. And again, you'll see in the software we have a whole range of sort of needling techniques from Dr. Gerwin. So that is the quadratus plantae, heel pain, heel spur, QP. Hope you enjoyed that video. Very much forward to looking to see you again soon. Thanks for watching. Bye.